Living donor liver transplantation is such an important tool to have. If you are on our waiting list and if you have a living donor, we can plan your transplant, and we don't have to wait until you're at the top of the list and very sick.
In living donor liver transplantation, we use the portion of someone's liver who is alive and replace the entire sick liver with that portion of liver from someone who's healthy. I think living donor liver transplant is really important because patients who have liver disease, the predominant time in which they face severe risk is before transplant, not after transplant. And living donor transplant enables transplant at a time when it's ideal without the risk of dying before transplant.
I take care of patients both before and after they have a liver transplant, so all of the care leading up to a transplant, and then all of the care after a transplant, you kind of follow them through their whole journey. There's a lot that goes into a transplant evaluation. Each patient who undergoes a transplant evaluation will be evaluated also by a nutritionist, transplant social worker, psychiatrist, surgeon, pharmacist, financial coordinator, living donor coordinator, myself, and the nurse practitioner I work with, sort of as a group. And we do this as a team because we also take care of these patients up until transplant and then after transplant as a team.
I work along with wonderful social workers that go above and beyond. We're part of this broader psychiatric/psychosocial team. And our objective is to enhance their chances of having a successful experience.
So living donor transplant gives patients access to transplant much faster. For a lot of patients, it instills a lot more trust in their outcomes and allows for them to be more at ease as they're approaching the process, because oftentimes they're aware of who their donor is and allows for them to schedule when their surgery is happening as opposed to waiting for an extended period of time.
Living donor liver transplant is an amazing aspect of liver transplantation. It also requires the participation of multiple teams. One team that is dedicated to the donor surgery, where they have to split the liver to recover a part of the liver that will be transplanted, and another team that works on the recipient that will remove the diseased liver and re-implant the new liver or new part of the liver to complete the transplantation.
And I think for most of us, we often say waiting is the hardest part, but it's really true when you're watching someone you love deal with illness and you don't know when you can get the treatment or if you can get the treatment in time, because being on the list is not a treatment. Getting the transplant is the treatment. So living donation enables you to get the treatment that you need.